this video we are talking about the terminal part of the anal canal. You know that the anal canal is the most terminal part of the whole of the large intestine. It is around 4 centimeter long. The lower part of the anal canal, we can see some columns. You can see this, these are called anal columns. So, these anal columns actually lower edge there are some anal glands. If we follow a horizontal line across this lower edge of the anal column, this is called pectinate line. So, pectinate line is actually a imaginary line which is dividing the anal canal embryologically into two parts. The upper part is derived from endoderm, primitive endoderm, and the lower part developed from the ectoderm. So, naturally the upper part the epithelium is simple columnar, the lower part is stratified squamous, the upper part the nerves are autonomic nerves, the lower part actually the nerves are somatic nerves like pudendal nerves. The blood supply also is different. The upper part is superior rectal artery, the lower part is inferior rectal artery. The venous drainage also is different. Upper part is superior rectal vein and lower part is inferior rectal vein. Superior rectal vein follow the venous radicle and drain into portal vein. Inferior rectal vein on the other hand go into systemic vein like pudendal vein, which go ultimately into systemic vein like inferior vena cava. So, this pectinate line forms a very important demarcation in the anal canal embryologically as well as clinically. So, why I am telling clinically? The main important thing here is about the nerve supply and about the venous drainage. The part above the pectinate line is drained by the portal system of vein, the part below the pectinate line is drained by systemic system of vein. So, porta systemic anastomosis are found in this area, and this porta systemic anastomosis vein can be enlarged during portal hypertension producing hemorrhoids. And what about the nerve supply? Any pathology above pectinate line will be potentially painless. Any pathology below pectinate line will be potentially painful. Why? Because the upper part the nerve supply is autonomic, the lower part is somatic. So, if you have got a patient of cirrhosis with portal hypertension and there is formation of the hemorrhoid, and hemorrhoids are internal hemorrhoid like this, you see in this picture, this internal hemorrhoid will be, although the patient is bleeding and bleeding through the anal canal, it is completely painless. Why it is painless? Because above pectinate line they are innervated by autonomic nerve. Autonomic nerve does not respond to the pain, they respond only to the stretch. On the other hand, below pectinate line, if you get external rectal venous plexus which is developed, which is actually derived from inferior rectal vein, they go to the systemic vein. So, if they produce hemorrhoid, external hemorrhoid, they will be highly painful. Why? Because these are supplied by the somatic nerve which are sensitive to pain. Now, in the subdivision of the anal canal there is a third area also. What is that? You can see here the wall of the rectum. In the wall of the rectum there is circular muscle and longitudinal muscle. The circular muscle form internal sphincter of the rectum which is supplied by autonomic nerve, and towards the outer part here you can see the sphincter ani externus which is the external sphincter. The difference is that this is smooth muscle, this is skeletal muscle, this is supplied by autonomic nerve, this is supplied by somatic nerve. So, if you go at the junction point between the internal sphincter and external sphincter, there is a groove. This groove is called intersphincteric groove. If I join this a line across this intersphincteric groove, this is called white line of Hilton, and this white line of Hilton divide the part into upper part and the lower part. So, lower part is actually skin covered area, like it is somewhat colored and bluish blackish color, and it has also contained here, but the upper part is stratified squamous which does not contain here. So, we can divide ultimately into how many subdivisions the total anal canal. If we draw the anal column at the lower end of the anal column pectinate line, the part above pectinate line, the part between the pectinate line and white line of Hilton intersphincteric groove, and the skin covered area which is below white line of Hilton. So, that is why the internal lumen of the anal canal is of a very important consideration because of these three important subdivision. The part above pectinate line which is having autonomic innervation, having simple columnar epithelium, below pectinate line which are somatic nerve, stratified squamous epithelium, ectodermal development, and that part again is divided by white line of Hilton into upper part and the lower part, and the lower part is completely skin covered area.